I was asked to say something about benefits packages as well. Before I do that, in terms of deciding what services are available and what should be provided, we've heard a lot about value for money, and I think it is important that the benefits package question is only one part of the question of how to use the funds that are available. There are other ways of improving efficiency and equity in the use of resources. In the World Health Report, we estimated that between 20 and 40% of health resources in many countries are wasted because of various forms of inefficiency. There's a lot that we can do to improve efficiency even before we turn to the question of a benefits package. Let me turn to that now, the benefits package. As you will recall, the 1993 World Development Report talked a lot about essential package of services. And Jose Luis Bobadilla at the time spent quite some years going around countries trying to work with them to develop a benefits package. In WHO, we had a lot of pushback from countries on that, partly perhaps because they weren't making the financing changes necessary, but many countries said, we don't want you outsiders helping us to develop a benefits package. It's got to be a homegrown benefits package. And so in WHO, we focused much more on trying to say, here's some tools that you could use to decide what interventions should and shouldn't be available. We produced something that you might have seen called the Who Choice Project, which now has something like 800 or 900 interventions in it. We've done it for 14 sub-regions of the world, and we have a country contextualization tool that countries can use to say, well, what would be a cost-effective set of interventions for our setting? There hasn't been good uptake of this tool, and I've been trying to reflect why. And I think the paradigm that we have used for cost effectiveness and health technology assessment comes from developed countries. The problem is that the NICE, the National Institute of Clinical Excellence in the UK, for example, it asks a question, a new medicine becomes available, should we pay for it? It has the system that's sort of working, and it has to just say, do we pay for a new medicine? That's not the question that many of the countries that we work with are asking us. They're saying, well, and sorry, let me just step back a little bit. And in those countries, they have a fundamental problem that when a patient presents at a primary healthcare level, and when a patient presents at an outpatient, even at a secondary or hospital, you can't say, what's your diagnosis? They won't know. You can't look up your book and say, is it in my package? If you don't have the disease that's in my package of essential services, go away. You have to do something for the people that turn up at primary level. And so what the countries are asking us is, okay, what's the set of things that we should do at the community level, primary level, secondary level, tertiary level? And they don't ask that in terms of interventions. They say, what are the people that we need to have with what skills at the different levels? What are the medicines that we need to have there? What's the diagnostics that we need to have there? And when do we push people up the system? Or when do we have community-based interventions? What's the set of prevention promotion interventions that we need at the same time? And so I think that the way that we've been asking this question about packages and trying to answer it with cost-effectiveness type analysis is not the way that countries are asking the question, and we need to do a lot more on that to try and answer the questions that the countries are asking. What's the set of people with the skills that are needed in the community at the primary level, first level of care, secondary, tertiary level of care? What's the set of medicines, diagnostics, etc.? What's the mix of prevention and promotion that will back that up? And palliation as well is something that's becoming much more important now everywhere. So I'm still against trying to set packages from externally. I'm still against trying to say, here's a set of interventions that every country should do. Now, that being said, obviously, that's an extreme version. That most of the interventions that are currently in the MDGs, you would expect that most countries would want to provide. Some of the basic interventions for non-communicable diseases, for prevention, promotion, treatment of non-communicable diseases are something that we would want to see in almost every setting. But that being said, where? At what level of care should they be provided? There's a lot of work that we just haven't done there, and I think that that's something that we need to keep working on.